Thanks immensely for that generous introduction, and multiple thanks, really. First of all, to you all for, I guess this is a balmy spring day for you, but it is daunting to those of us from the South just to see your snow or car piles along the streets. Quite remarkable. I'm so delighted to see this level of interest. I'm also grateful to you all for allowing me to shed my provost's, not robes, but whatever provosts wear, for a bit. As you may know, provosts are sort of chief operating or chief academic officers of universities. I'm good friends with the provost here, David Harris, and know the kind of days that we have. It's so wonderful to come and talk about an academic subject and a policy subject that's dear to my heart. And then thanks also for putting up with a policy guy. I'm not an epidemiologist or a clinical researcher or a medical expert in the least, so I'm trespassing on your territory. I don't have experience in RD programs and the like, although I have sent a number of my wonderful policy students from Yale, from NYU, and now from Wake Forest to this school and to work with the center. I really admire the conjoined relationship that the Friedman School and the center have. It's unusual, and you all have some appreciation for it, especially if you're working in them beyond studenthood. But you students have something remarkably special here, the opportunity to learn from two different kind of institutions that in most other universities there are walls built between institutions like the center and the Friedman School, and the fact that they collaborate and intertwine so successfully is really something to admire. And it's been wonderful talking to your director, and I see the dean of the school later today, so to give them both appreciation. So I'm going to talk about obesity politics. I'll just start by saying that for much of modern history, for you students, most of your lifetimes even, we didn't think about obesity as a policy topic. We have this marvelous juxtaposition, which is an actual billboard in LA. This is a pair of billboards. This is not made up for the purpose. But the notion this is a policy issue, it took a very long time to center on, and has been a fight in some ways, as I'll describe, simply to establish this in that capacity. When I give talks to groups of food industry leaders or others who aren't in schools and centers like this, when I have to begin, half my talk has to be about demonstrating or persuading people this is something policymakers should, or at least to some extent, are paying attention to. I don't need to do that here. I'll just remind us for establishment purposes. I assume you've all seen these maps. You may not know, but it was the leaking of the original obesity map showing the spread of obesity by a mid-level bureaucrat at the CDC, Centers for Disease Control, to CBS, which put them up, or which displayed them on 60 Minutes in the year 2000. That's what launched obesity, or moved obesity from a subject of vital clinical attention. The medical industry and health policy officials were deeply attentive to something that hit policymakers' agendas. This was not something that policymakers were paying attention to in any meaningful way. It was an actual act by, again, a mid-level bureaucrat at the CDC who was so frustrated by the lack of attention to what she saw as this inexorable spread, worrisome epidemic-like spread. And if you don't know the maps, basically show the light colors are states in which obesity rates were under 10%, if it's really light blue, under 14% or under. Not that much to worry about. And then you can see over time they've come to the a few short years, 20 years. Most of you were alive across these 20 years. So it's our lifetimes that we've seen this remarkable spread from less than 1 in 10 people in most states to as many as 1 in 3 in many. And the projections have continued to be terrifying. This is just a projection, and obviously the world changes. But in some of those, I guess, aptly red states in this case, for so they are politically, you've got 60% or more of adults who are, based on regular BMI classifications, are defined as obese. Again, I'm preaching to a choir, I suspect. I usually spend a lot of time trying to establish this as a legitimate source of concern. A friend of mine has recently done this fabulous map of the U.S. based on which fast food chain is most prevalent, has the biggest sales share of the market. So you can see across the country, yellow's McDonald's, so across the East Coast and Midwest and so on. Down south, I forget which the white one is. It's something like Dairy Queen or something. You can see it across Texas. Anyway, just one fascinating way to look at the U.S. from fast food terms. Again, when I speak to food industry audiences, they sort of take this apart. So I'm going to stipulate as the lawyers say, that obesity is a source of grave concern beyond, although vitally importantly in, clinical research, nutrition, the kinds of settings you spend your days in, also something policymakers should pay deep attention to. I'll stipulate that again. Usually that's much of the talk. It is increasingly attended to by folks who do policy making for a living. And what I'd like to do is situate the different ways, and this is a headline from just a couple of weeks ago, and after 15 years of policymakers at least paying attention to, thinking about, trying to make sense of, this is the best we've come up with. It's complicated, and we need to do something different from what we're doing now. I exaggerate a little. That will be the theme of my talk, basically. I'm going to look at the different ways that policymakers have approached, and then sort of fondly could approach, the question of addressing obesity. I'm going to particularly focus on diet and nutrition, partly because I'm in a group of experts on diet and nutrition and the like, but also because when the industry and its supporters in the policy realm promote solutions, they tend to focus, in fact they drive very hard, on exercise. They don't like solutions that affect their bottom line in general. So I'm going to focus on diet and nutrition particularly. We can get into, if there's a Q&A session, which I hope there will be, we can get into the aspects and details of the extent to which policymakers should place efforts on that scale. So here's what I'll do. I'll take a different set of who should ask answers that have come up through the policy system. I'll have 4 or 5 in all. In each case, give you at least a brief summary of a particular way in which the policy world, those of us who have experience in the policy realm, academics and also policymakers in general, with whom I spend a lot of time talking about this issue, have approached it. And the first in the United States is almost always a laissez-faire approach. It's up to us, individuals. And indeed, after that moment in the year 2000, when obesity emerged as a policy issue, one way to measure this, I've written a lot about the framing of public policy and agenda setting, meaning when something moves from an issue that a handful of folks in universities might be concerned about to a national conversation about public policy. As obesity again emerged in 2000, thanks in significant part to this Obesity Maps on 60 Minutes, followed up by a Surgeon General's report on the dangers of obesity. When it emerged, the first frame, the first way we talked about it was in very much laissez-faire terms. Now, this is so deep in American politics and culture, the idea that it's a central thread through our political fabric since before the founding of this country as the United States. The idea that it's up to individuals and that the government should keep its hands off generally what's in our private lives. Lots of ways in which that's not true in practice, but this frame or this general set of ideas around personal responsibility, or what's also called consumer sovereignty. So it's a familiar point. The idea that we consumers should exercise sovereignty, autonomy over our decisions. This was a powerful frame that was brought forth, not because it's the whole way to think about this issue, because it's morally most true, but because a deliberate set of political actors promoted this point of view. It's up to us individually, as an editorial that was popularly circulated and turned out to have been paid for by actors with particular interest in this, widely 124 different papers reprinted an editorial that, after the year 2000, when this issue again hit the policy agenda. Government should stay out of your kitchen was that headline. And around the policy world this went. So you saw lots of ways in which this personal responsibility frame or point of view was put forth. And for 5 or 6 years, for those of us who study this from a policy angle, this was the dominant frame. This is how members of Congress talked about obesity. This is how state officials talked about it for the most part. This is how most of us came to initially think about, yes, it's spreading. Yes, it's a source of concern. Yes, policymakers should probably be interested, but in very light, hands-off kinds of ways. And you saw it in what was coming out and promoted. American Enterprise Institute, a center-right, established policy organization, churned out things about the importance of individual responsibility, as did the Cato Institute, another example. Lots of frames or lots of headlines like this one help to reinforce, again, a way of thinking about this issue politically. It remains a powerful, or its success was very powerful in an elaborate, quite useful survey a couple scholars published a couple years ago. People asked, what's the primary cause of obesity? As a large sample of Americans not necessarily versed in this issue, you can see that 80% of people said that individuals are the primary cause. Parents, got a little mention as well as another set of individuals, though. Very difficult to see other kinds of industry, except food manufacturers, as a primary cause. You can see the power of this frame. And it has not changed to this day. There are still folks with a vested interest in this view who are promoting. This is a right-wing blogger. If you've never seen White House Dossier, it's a delightful site that whacks the Obama administration right and left. But just from a couple weeks ago, as you can see, here's the government in your kitchen. This meme, this frame, this trope, this metaphor has been constant drumbeat since this became a policy issue. At the same time, due again to individuals, I just want to make the point, particularly for you students, these policy arguments don't just fall to earth somewhere, or they're morally true and we pluck them off moral philosophy trees. People make them, people advance them, people promote them, and they do so for all kinds of interests. A small set of political actors, actually, sadly, particularly academics, as opposed to interest groups rising up and saying, there's a different way to view this, but particularly academics, and one person in particular, an academic named Kelly Brownell, was at Yale for many years and has moved to Duke just recently. I assume you read some of his things in your classes, promoted a different point of view, and it became a meaningful competitor, again, those of us who measure how issues are framed and how they go on the agenda, the notion that there is a toxic food environment or obesogenic food environment. Again, I suspect these are familiar terms to you. I want to emphasize at the beginning of the talk that this is how the policy debate about obesity was carried out initially. It's your fault. It's personal responsibility was the initial story that came out, and therefore policymakers, there wasn't much they could do. It's hard to mount a program of regulation, and taxation, prohibition, the kind of tough, regulatory, government-engaged policy moves when the frame is one of personal responsibility, get the government out of the kitchen. However, the toxic food environment frame began to gain traction. I'm happy to go through again in Q&A some of the details of how this happened. I've written about it elsewhere, and as have many others, including Kelly Brownell. But what advocates for this view began to do was just try to promote a different set of images and ideas. So you saw things like this, widely put out. Now, you all are deeply familiar with our food environment, and many of you have written about it and studied. I'll just let the images linger. But Kelly and others were actively trying to educate and engage the public in a different sort of way. So we see this again, familiar to you all, but it is astonishing to see how these average sizes grew. It's more than 4 times as large in just 30 years. The average, what you get when you go and buy a soda. So all the way across. These are, again, deeply familiar to those of you here. In 1980, the average sandwich was 320 calories. Turkey sandwich, average sandwich size today, how many calories? Oh, somebody say. You mouthed it. Go ahead. 570. Good guess, but far higher. And then again, here I did this just because there's a difference. You almost nailed the difference. Nicely done. And again, here in the center and the Friedman School, I hardly need ask you things like how long you have to bike to do that. But you've got to bike an hour and a half to make up the difference in a typical sandwich size. So again, the idea was, and I was part of those who tried to help promote this, let's get a different frame in place that suggests it's not individuals' fault. I mean, we know, in part from stigma studies as well, it's a terrible way to promote policy change, to say it's your fault and you must do something about it. I will also again note it has very deep roots in American life. And it's no accident that some of the initial policy conversation, again, the chatter that takes place in congressional debates and in kitchens and all around the country and political campaigns, was often framed in terms like sin and decadence. There's a long strain back to some of the Puritan arrivals on these very shores, not far from here, casting things like gluttony as personal vices. It's not something the government should handle. And you've seen folks tap into that language in this policy debate. And then you have helpful characters teaching young children of the importance of eating a balanced diet, like this national representative. I think it's the Surgeon General in action. So, toxic food environment comes to place. A bunch of us started writing about personal responsibility in different ways to, yes, it is in part up to people, but it is also environmental factors, and we need to look at them both. And you could see recently, just in the last couple years, more media approaches that wonder if personal responsibility is the best way to think about it. So we're still in a debate, is one message, around basic framing. Is this an issue? The government should have much to do with it all. Again, I stipulate at the beginning it should. It'd be rather dull talk if we all decide no, it shouldn't. But you're beginning to see headlines, just in recent times, some of these are from around the world, but as well as in the U.S., suggesting that, as the headline there says, obesity can't be controlled through personal responsibility alone. Part of it is there was attention to the spread of obesity in ways that, again, you all in this school and center chart and help us understand. It was not being halted by lots of nanny-like, nanny state's an issue we'll circle back to, but lots of messages about how you should change your behavior. So we began to see different possible frames. So who should act? Us individuals, we're now beyond that, at least to an extent, and we see the state, by which I mean not Massachusetts, in which case I'd say the Commonwealth, but the collection of different levels of officials in the U.S., state, national and local, of course, that together make up our governing apparatus. So we call that the state for shorthand. The state should act. Most other countries faced with the spread of obesity, which of course is a global phenomenon, their states stepped in ways we'll get to in a few slides. But in the U.S., when the state finally begins to act, they do so in lots of ways, in lots of realms of public health. They do so in a way that political scientists identify as submerged, not as visible. In part because, again, there is a very powerful frame, powerful set of actors suggesting this is not an issue that the government should have anything to do with. So if the government, if we can have policymakers persuade they should act, they do so in subterranean, invisible, out of sight, out of public debate kinds of ways. Is this the best way to make public policy? Absolutely not, it turns out. And Suzanne Mettler, who's a longtime colleague of mine, has a wonderful book. It's a little whited out there, but Submerged State is what that says. You see the top, how invisible government policies undermine American democracy. This is not a desirable way to make public policy, but this is how we do it increasingly. And health policy is particularly a realm in which this takes place. I could go into lots more detail, but let me just let that hover and give you a concrete example here. So, when we're trying to encourage change in our obesogenic food environment, a number of policy advocates, analysts, policymakers, engagers, and so on have concluded we need to engage the food industry. We're not going to do this by trying to work against them or thwart them or tackle them. Or be interesting to get your sense of whether that's a legitimate course of action to take, and there are some who absolutely insist it should be otherwise. But quietly, in ways that I had a wonderful dinner at the home of two of your obesity, or at least nutrition policy experts last night, didn't know this was happening. So this is not widely publicized, even in our community of folks in the know. The government has in place, the federal government in this case, not the state or local, has in place a set of pilot programs that give tax incentives to food companies that reformulate their products, that reduce the amounts of fat, sugar, and salt in what it is they make. This notion of reformulate, now let me say again, this is things that are generally not good for us, high fat, low nutrition, junk food, snack foods, use the terms you have learned in class and so on. I'll use these synonymously in a way I know I shouldn't. There are now programs, again, that a food company, a food industry representative can apply to get tax breaks for making a product a little less unhealthy. Again, reducing fat, sugar, and or salt in an effort to do so. There's a lot of examples of this. It tends to happen out of public view. Now, the industry says, and it's believable, I think, that they do it out of public view because Americans won't buy products that are LITE light or less fat or so on. Or, if they do buy them, they tend to eat so much more of them, thinking they're doing something virtuous, that whatever the beneficial difference is erased. So reformulation is done mostly out of public sight, as is the policy around it. The submerged state idea is, again, that we make policy through tax credits, for example, or budget moves, things that are generally out of sight. Not illegal, but they're out of sight. So any of you who own a home, you get a mortgage interest deduction through the federal government. If public policy makers and analysts suggest we made obvious and public what an enormous tax benefit that is to mostly middle and upper middle income folks to buy homes, there might be some kind of protest, disagreement, et cetera. So we do lots of our policy making through the tax code in ways that are so arcane and difficult to follow that they are submerged, according to this political science description. And again, reformulation is one. So you occasionally see writing about it. They were doing it specifically in the EU to address childhood obesity. This is a piece from today asking whether reformulation will take place with some new World Health Organization nutrient profiles and so on. For the most part, this is done very quietly and privately. So I'll give you an example, a concrete one. A food company I can't name, but that uses some arches as their symbol, has mounted a pilot program in 3 states, the so-called tri-state area where I grew up, New York, New Jersey, and Pennsylvania, where they've taken a familiar product, their mayonnaise, and they have, without telling anyone, so you're the first to know this, and those of you watching and tweeting and so on, I'll ask you for the moment not to repeat this because it's an experiment, but they've titrated down. For some reason this verb is often used in reformulation conversation. They've titrated out, again, half the fat and salt in their mayonnaise. They're doing it in 3 states, and they're not telling anybody. So here's an experiment. Go to a restaurant with arches and take a packet of mayonnaise here. And next time you're in New York, New Jersey, or Penn, this is going to run for about the next 6 months. Next time you're there, get a packet there, and you won't be able to tell the difference. The chemical magicalness, the chemical remarkableness of the company, of the ability to make things taste and feel and umami and so on is quite remarkable. So anyway, reformulation is one small example of ways, again, that we have submerged policymaking. No one's saying, running big banners, that these companies are doing it. Again, they're claiming that if they announce it, we won't eat it, and we'll see. But they're running tests now to see if this could. So this falls in the category of making generally bad nutrition decisions a little less bad, since we're going to eat those things anyhow. It's a little cynical, but it is one of the major ways in which, and this is, I think, a sad fact, one of the few major ways in which the political industry has responded to the obesity epidemic. Others we can see are things like tax breaks to come into food deserts. That's not necessarily directly related to obesity, but as I'm sure you're well aware, it tends to be lower income folks who see the highest rates of obesity, and we know that food deserts exacerbate obesity because it's so hard to find healthful substitutes for the kinds of things you can buy at drugstores or pharmacies. So there are, again, in a submerged way, there aren't overt programs nationally announced where we regulate neighborhoods to say you must eat these kinds of foods. There was one effort in Los Angeles to try to pass new zoning rules that said fast food companies couldn't, or fast food restaurants couldn't be located near schools. That failed miserably. So instead, what policymakers have done is to try to put tax incentives in place. Again, working through the tax code costs us money, but it's much more arcane and difficult to follow. And then there's, as well as these carrots, tax benefits if you reformulate your products, tax benefits if you come and locate a supermarket or a grocery store with fruits and vegetables and other healthful options in areas that don't have them. There's also sticks. For example, the soda tax. And I can go into that in some detail if you like. That's been a very difficult journey. Some policymakers, for example, the then Chief Health Officer of New York State, a fellow I came to know well, Richard Daney, absolutely believed that a soda tax, a significant tax on consumption, would make a meaningful difference in consumer behavior, would reduce consumption of soda, and therefore help to at least blunt one of the most obesogenic things that we consume at a massive rate. And if you look state by state, or certainly nationally, you will see a paucity of places that have managed to pass a soda tax. The Richard Daney story is a very sad one. He really based his main effort of his office on the attempt to pass it. They came 1 vote short, and he was literally brokenhearted. He actually died some months after this policy failed. Those of us who knew him well believe with pain that it was the failure of this policy that led to, in part, his brokenheartedness. So, different story for a different day. But the soda tax story, again, it's a carrot, a way to, through the tax code or through tax policy, shift consumer behavior. But it has so far been very difficult to overcome active food industry lobbying. All right, one example. The state can act in these submerged out-of-sight ways. The state can also act through nudges. And soda tax could count as one of those, although we tend to class tax policy changes into submerged category. You are, I suspect, again, familiar with the whole nudgeocracy idea, the notion that through, again, subtle behavior changes rather than outright regulation. You notice all the sort of sleights of hand and subtle ways in which government officials are trying to change behavior because it's so difficult in this country to bring about overt changes in our dietary nutrition policy realm, in part because of the enormous success of the personal responsibility frame. So you're noticing these workarounds, essentially. It's an exhausting way to make public policy. And at the same time, I guess it's an intriguing one. So with respect to this what was sometimes called the psychological state, you see lots of examples that affect the world of diet and nutrition. School kids in Connecticut who are encouraged to consume apples through a pilot program that doesn't just make apples free, which happened in a number of places, including some Massachusetts schools. What turned out in the initial round of study, and I was part of one of the studies in Connecticut at Yale that did this, the apples were there and available and free, but the kids weren't taking them, partly because they had to ask for them. So then they tried to put them right there where it was obvious that the apple was available. Then we tried a set of pilot experiments, again, under this behavioral or psychological state realm. Government is acting, but acting in ways to change behavior subtly. We put the apples on the kids' trays. That increased consumption, but it turned out if we cut the apple, or the food service workers cut the apples into four segments, then the kids ate them. So there's lots of interesting behavioral kind of work of that sort. It happens in other countries as well. In Buenos Aires, you may have heard, there they have a more powerful ability to regulate than we do in this country around food and nutrition policy, at least. An edict came down from the city government of Buenos Aires that no more individual shakers of salt could be on restaurant tables. They had to take them all off. And actually, consumption of salt in Buenos Aires is one of the particularly high sodium consuming cities. It came down by 40% by removing salt shakers from diners' tables. A number of examples like this around the world, in the U.S. as well. New Yorkers have been subjects of this choice architecture, as the term goes, to an extensive degree. You likely know this is under the header of libertarian paternalism, kind of oxymoron. Libertarian means, again, relative laissez-faire, freedom from government influence. Paternalism is, of course, the hand of government. These behavioral nudges are meant to simultaneously enable choice, but within constrained boundaries. And I'm assuming you've encountered this. It's enormously popular at this point. The writer Cass Sunstein and his co-author Richard Thaler popularized the term nudge in a book 5 years ago now, and have continued to write about this. In particular, lots of attention. This is Cass's book from a couple years ago. Particular attention, actually, to the realm of diet and nutrition. They've been very interested in how we can address the obesity problem. I've had long conversations with Sunstein, one of the two co-authors, about ways to, again, in subtle sorts of ways, establish choice architecture in ways that can make a difference. Let me take a slightly extended trip into one example of a policy attempt to change people's behavior through choice architecture that I was deeply involved in. I'll just note there's another wonderful, if you're interested in this sort of thing, another, this is the subtitle you can't see, is On the Rise of the Psychological State. And they have a number in this book of examples of ways in which diet and nutrition have been approached through these subtle behavioral transformations. But let me talk about calorie labeling just for a moment. I know that this is probably something you all have taken up as well, but because I was deeply involved in the policy fight, I hope it's an illustrative example of both the intriguing possibilities of, bless you, of nudges, but also the complexity, because this is a relatively new area, and made a note about the fact that both in the White House, they have something called the Social and Behavioral Sciences Team. It was established by the Obama administration. Cass Sunstein, who came into the administration, as you probably know this story, he's a law professor, but moved into the administration. He'd known Obama as a student at Harvard Law and then as a colleague at Chicago Law, so they're long connected. He became the head of the obscure Office of Regulatory Affairs, but from there he figured he could put lots of these nudge-style things in place. But he also helped to build something called the Social and Behavioral Sciences Team in the White House, located in the old Executive Office building, significant way they move through different possible policies, looking for ways, again, subtly, not through heavy-handed regulation or even tax policies, but just to change people's behavior in these subtle kinds of ways. Some dismiss it as terrifyingly paternal. Others say it's too libertarian and won't bring about a difference. Let me tell you a story of how complicated it can be in practice. So again, for a while we embrace these things with great relish, but so many things in policy, they turn out more complicated in practice. British Prime Minister has also established something called the Behavioral Insights Team in 10 Downing Street, which is if you've been, it's a small building cluttered with offices, but they feel it's so important to try to bring out these changes. So both of these, old, advanced democratic countries have a team specifically devoted to bring about policy change through nudges. So it's gotten some foothold. I noticed just in Boston today that at least some of the fast food, I always make my way through fast food restaurants looking to see if these labels are on menus yet. Not all, but you've got some. So you've started to move on this. Boston or Massachusetts has not passed its own law on this. You all will follow federal law. But let me give you a little background. This is what it looks like if you haven't seen it. This is a little confusing. These calorie ranges can be part of the difficulty. I mean, you know, what on earth is going to entice you to get these? It's also, so the first menu labels were passed simultaneously back in the early 2000s. It seemed like an early possible way to change behavior without, again, heavy-handed regulation, without government being in our kitchens. King County, Washington, that's Seattle basically, and New York City passed the first ones. King County got hung up in court fights for a long time, so the first one to actually go into effect was New York. It took them 5 years from the original passage in 2003 to the year 2008. And the rule in New York, as eventually was rolled out elsewhere and will eventually be national, it's finally coming to pass, or horrifyingly coming to pass, depending on your point of view. I'm assuming finally, maybe some of the view in here. In both cases, or in all cases now, the basic rule we've settled on is if a food establishment has 15 or more locations nationwide, it is required, whether it's sit down, like in this, I think this is from TGI Fridays, if I remember right. It is amazing if you look at that. All your calories for the day in a single entree, but let me not make editorial comments. If you have 15 or more locations nationwide, you're required in a font and size that's the same as the price to list calories. So you see examples here where they're following that rule. Again, bitterly fought by the restaurant industry, the Restaurant Association, 5 years of litigation just in New York City, finally got passed. 3 seconds on public policy, which you all, I'm sure, again, have studied in your course of study here. But we tend, when we pay attention to public policy as citizens, might be aware of the framing battles. We're involved in the conversations and so on. We know there's a legislative debate. Then something passes. That's the big moment. We all get excited and pay attention. Then we don't usually pay much attention to the implementation phase, which is, for me, where the really interesting politics happens. In the years I worked in Congress and on the Hill and in the White House and so on, I love these implementation fights. It's out of sight, but that's where some of the real politicking happens. Once that's done, we really tend not to pay attention as a people. You know, it's past Congress, President signed it, lights are off, they've gone home, then the process of rulemaking takes place. I pray that any of you interested in policy study that at the Friedman School or elsewhere at Tufts. It's so important to understand the rulemaking implementation process. But when that's done, we really don't pay attention. Again, this is where the interesting part of the policy cycle starts, the evaluation. Does this policy make a difference? And we in the United States do a very poor job compared to lots of other advanced democratic countries on policy evaluation. Finally, we got this thing in place. Of course it's working, we say. So I was very intrigued. I was at NYU and I was deeply involved in this calorie labeling thing. I thought it was fabulous. If it just passes, it'll make a real difference. Finally, something is going to come to pass. I had a colleague, an economist. They tend to think more soberly than we political scientists. I'm a political philosopher, so I love to imagine things that could be. And my colleague Brian Elbow, NYU's medical school, and also the Wagner School, where I was, their school of public policy, similar to Fletcher, he didn't think it was going to make much difference. So we made a bet, and then in good academic fashion, we explored it together. So we wanted to conduct an evaluation, not 10 years after calorie labeling was in place, because if you wait that long, which often evaluation studies do, you have to wait for a grant if you're an academic. We all have been through this. And by the time you evaluate the policy, it's in place, the bureaucracy is going around, it's never going to change. We want to do it fast. And Robert Wood Johnson Foundation, which is a fabulous source of many good things, and never gives us enough money, all my colleagues are nodding, but at least gives us some, had this new rapid response grant program. If a policy passes, they'll give you a grant, even as it's passing, to examine it. So what we wanted to do was a study to see if calorie labeling made a difference. And I can take you through the methodology in detail if you like, but I'll spare you that and simply say, essentially, I lost the bet. It doesn't make much difference. We looked at low-income areas of New York. We then went back and did a second study, also RWJ funded. Philadelphia passed their labeling law in the time after we did our study in 2010. We went back and looked not just at low-income areas, but both. And we found the same thing in both cases. We've continued to study this in lots of different ways. But we did what's called a difference in difference study. I pray you know what that means. You need to control cities. So for New York, it was Newark. New York passed labeling. Newark didn't. Philadelphia passed labeling. Baltimore didn't. There was our control there. And we basically actually went and did street intercept surveys. We went and talked to people on their way into a chosen set of fast food restaurants before labeling was into effect, both in New York and Newark, or Philly and Baltimore, and then after labeling was in effect in New York but not Newark. So you have a difference in different study to see if this policy makes any difference. You compare, you get the point, yes? If this is baffling, see me after. In any case, we did a couple in New York, we did adults and kids, we followed up as I said. This was our finding, cutting through to the chase. You can see in Newark, the calories pre and post labeling don't change. They didn't have labeling. That was good for our finding. In New York City, the calories consumed, which we were sure were going to go down, which New York had, Mayor Bloomberg and his health team had put an enormous bet on this being a meaningful source of reducing people's consumption. They actually went slightly up. Not statistically significantly up, but they went up, not down. Enormously distressing. And for those of you interested, we went across lots of different ways of trying to measure this, including whether you noticed calorie information or not. People went in, it was up there on the boards, and some said they didn't notice. We mostly were focused on those who did notice it. Didn't make any difference, or it made in fact, it slightly increased consumption. So we wrote a paper, and then we got lots and lots in ways academics don't often, so it was, dizzying in a way. Lots and lots of attention, lots of criticism in part, particularly from the city, which wanted to shut down our study and said that it had gone wrong and so on. I think they were just so disappointed. So place after place ran these sort of man bites dog stories that said, we put these labels in place and it doesn't matter. I was gloomy, not just because it had seemed like it was one of the very few policies addressing diet and nutrition from a political standpoint that actually passed, had so few successes across the time since 2000. So in a way, it's a personal story of disappointment, which should mean nothing to you, but there it is, because I worked on it. It was so fascinating. But I also had lost this bet to my colleagues. So, we got together and thought about it more, and we wound up running a separate study, and I left Yale after that time, so I participated in the beginning but stopped. We ran a separate study, which again, takes too long to go into, but was enormously exciting to participate in. We tried to figure out if, along with the mere fact of, as I'll say, one thing we found, so people would come in, we'd ask them on the way in, backing up to give you a quick slight methodological description because it will help frame what this next piece was. I get so excited about this, forgive me. I'm going to start speaking faster and faster. So you're approaching a fast food restaurant, you see an attractive pair of researchers, students, young, vibrant, engaged, et cetera, who say when you come out, we're doing a study of taxes on food. Now, you never tell people quite what you're doing, but we didn't want to lie, so we did a little study of taxes on foods afterwards. We were telling the truth, nominally. They'd go in and say, when you come out, if you bring us your receipt and answer a few questions, we'll give you a $2 bill. I love these ethnographers who've studied so carefully that if you offer people a $2 bill, you will get a more positive response than if you say we'll give you up to $5. Because $2 bills are unusual. We show them, and they would fascinate. So most people did it, came back out. We gave them to them, and we asked them a few questions, about their consumption. We wanted to find out how much they'd actually eaten of the food so we could measure their caloric consumption. We also asked them, how many calories should the typical adult or child, we did an adult and child stratified study if they had children with them, how many calories should the typical adult eat in a day, we typically asked. I just kind of thought after doing this obesity research that, like you all do, people knew this. The answers range from 4 to 1 million. It's really, and the million was a little odd to be sure, but it was an enormous range of misunderstanding. So as my co-author Brian Elbel and I my bet partner in this began to discuss, we figured if people don't know how many calories they're supposed to eat, they actually may be falling prey to what these same behavioral analysts, these behavioral psychologists call false mastery. It turns out if you know something, a small amount that has a number, about something that has a number attached, you tend to accord great power to that number. So if you don't know how many calories you should eat a day, and you see the number 745, you think, that's not very high, I'll have 2. This is on average, on balance, what people do. So we hypothesized if you tell people right there by the calorie labels how many calories they should eat each day, 2,000 for an average healthy adult, right? It hasn't changed. Please tell me it's still around 2,000. Just nod or something, thank you. 755, you say? If you put that information and make it available, then folks will at least have a sense of what the range is. So we tested this wonderful experiment, and I had to pull out of it, but I was still on the paper when we did it. In the end, I won't take you through the whole paper. Basically, we tested in an experimental situation whether it made a difference to have a menu with item and price, a menu with item, price, and calories, just like the labels, a menu with item, price, calories, and a box at the bottom said the U.S. FDA recommends around 2,000 calories a day for a healthy adult. Made an enormous difference, it turns out. It was a fascinating finding. So we told the city, who was mad at us, because they're fine. And you got to love these New York City policymakers. They are so responsive. Within weeks of our communicating this finding to them, they'd put these all over the city. And they couldn't require, although they began to move towards requiring the fast food establishments post those in the restaurants. They put them on, particularly in the low-income areas where we've done our study. They did them in English and Spanish, and they did them on bus shelters and that sort of thing, subway stations. If you're from New York, you probably saw them because they ran for a couple years. And then, this is back in, at this point we're in 2009, and the Affordable Care Act is starting to move. And I don't know how many of you knew this or know it now, but even knew it then. There was a section of the Affordable Care Act that involved calorie labeling, menu labeling. And because we'd done this work, I got to go testify before a U.S. Senate field hearing. And we told them this story. It had just come out. And to my absolute astonished delight, in the Affordable Care Act, section I think it's 4475, they not only require calorie labeling nationally, as of the 2010 ACA Obamacare, they require calorie labeling nationally, but they specifically add, and you have to list 2,000 calories per day in a prominent place at your establishment. It's like the coolest thing that ever happened to me in my academic work. So when it, one of the headlines, San Francisco Examiner, when the ACA was upheld by the Supreme Court a couple years ago, let us pray that happens again, although I'm a little dubious and worried, they also put menu labeling on that. Now, they didn't make the opposition frame go away. This is from, again, a couple weeks ago. But it's taken 5 years, for 4.5 years from the point of ACA passage, for the implementation, the rulemaking piece of this to advance. It was such fierce politics. I wrote some about the rulemaking fight over the ACA. Again, the law passed. It goes into effect, right? Oh, no. Endless battles over this 2,000 per day requirement. The industry hates it because I think they've done their own internal research, I'm sure, and they see it actually cuts into consumption. All this effort, all this jabbering and arm waving from me for one little policy gain, that's the story of obesity policy making or diet nutrition policy making in this realm for the last 15 years. Yes, there's been advances of sorts. There's more money for research, which is a great thing in places like this. There's a little more money for nutrition education, which gets us somewhere but not very far. The obesity epidemic continues. There's a handful of recent examples that it's plateaued. We had a lively conversation at Professor Masters' home last night about whether this means actually this problem is going away. But there's lots of other evidence that it continues to be a life-shortening, various diseases exacerbating, quality of life reducing scourge. And it's a sad policy story when this is the best we've gotten. All right. Again, I promised that I'd circle back to what most other countries do when there is a policy issue of urgent attention, like obesity became, and the diet nutrition aspects that feed the concern. Most places, lots of other countries, and I won't go through endless examples because I hope you've studied this and know something about it, have passed regulatory measures. They did what governments do. They taxed, they prohibited, they reduced, they required, they cut back on, in fact eliminated in many of the Northern European countries, for example, food and beverage company advertising of junk foods and sodas to kids on kids' TV. They stopped it. We could never do that here, we say, because it's First Amendment, blah, blah, blah. So again, I hope you fought some of these out in class, but the point is lots of other places have put in place the kinds of strong policy moves we know would make a difference. All right, what could we do here? We're an interest group country. You need interest group engagement. You need active lobbying efforts to bring about some kind of change. Perhaps you loathe people who call themselves lobbyists. There's lots of wonderful public interest advocates who are lobbyists just the same. There is a strange, we also were talking about this at dinner last evening, there is a strange absence of organized interest groups lobbying federal and in some cases even state governments for strong changes in diet nutrition policies that would address obesity. Most other issues, I've been researching lobbying for a long time as well, most other issues, in fact I told these guys last night when I teach classes on lobbying, I put to my students, name me any other issue that's as significant, that's risen to the agenda significance of obesity and its diet nutrition aspects in the last 15 years that doesn't have a large number of interest groups engaged in trying to do something about it on the advocacy side. There was a bizarre, to me, absence of them in this case. Center for Science and the Public Interest may be going through your mind if you follow this. Margot Wooten and Michael Jacobson, fabulous folks, but two people, one group, poorly funded, trying to make a difference. So little on this. So for you students who find this policy realm intriguing, form an interest group. Get an advocacy team together and go to work because that's how this difference will get made. Also possible to mobilize the public. That's how we bring about significant changes in health policy and elsewhere. There's a paper out just this last week in The Lancet. It's a wonderful medical journal you likely know, published out of the UK, though, often has U.S. contributors, fellows from all over the world. They've got a whole piece on why have we been unable to mobilize the public around these issues. People are worried, people care, people are concerned. It's a good long piece. The authors, work through the empirics and so on. What they basically find is it's very hard to fight the personal responsibility frame. People think it's their fault, in essence, or the government shouldn't get involved. So there's a handful of these kinds of, momentary gestures, but they haven't added up to much in terms of active, engaged public policy. Happens elsewhere. In Ireland, for example, a place I've spent some time talking to government ministers and so on, they had 70 recommendations. As of a couple of years ago, they'd pretty much put a third of them in place, partly implemented another third. Now, they actually do things elsewhere. We do not achieve that in this country. Partly, as you know, if you know the policy system, it's veto-rich. It's very easy to stop public policies from moving, very hard to pass them. But we have such a dismal record of success. One little obscure piece in the Affordable Care Act that gets menu labeling in place. And again, funding for some education, funding for some research. But in terms of meaningful policy moves, virtually nothing. Actually, one bill passed the U.S. House between 2000 and 2010, a decade of attention and engagement and, again, discussions and so on. One bill passed. Not the Senate, but the House. Yes, please, you have to pass both chambers to be law, so it didn't become law. But the House bill was, listen to the title, the Personal Responsibility in Food Consumption Act, passed in 2006, facing this scourge again, this epidemic, these maps that each year made things look reported as worse and worse. The House passed a law that would do what? Immunize the food industry from lawsuits. That will solve our problem. But that's how powerful that again, the title is the Personal Responsibility in Food Consumption Act, right there in the title. That's all that passed. What might we do? It's a somewhat fantastical exercise, but I, with a couple colleagues, did a neat study, or at least we imagined it was neat a few years ago now. We're replicating it now. We're doing it again. But we basically, I'm fearful I'm running out of time. I'm looking to John to give me a thumbs down or a thumb up sign. He's giving me sort of a half-hearted thumbs up. So I will plow forward until someone rips down the curtain. He's either saying 5 minutes or waving. I'm going to assume he's waving. No, I'll do 5. We did an impact feasibility study. We academics do lots of feasibility studies, policy academics, that is. Would this policy make a difference? We ask lots of, in this case, nutrition scientists. So you get a list of policies, you reach out to folks who are experts like those in this room, and you say, would this make any difference? It's a feasibility study. They're great. But we had the idea, and I haven't seen many other of these, and one of my colleagues had the notion, what if we cross-tabbed that feasibility study with an impact study? So we did this. We picked 40 nutrition scientists, including a couple in this room. We reached out to them, or a couple at Friedman School more generally, reached out to them and gave them a list of, at that time, we did this back 5-6 years ago, so there were 72 policies that have been proposed, actually proposed in Congress, state or local level, we cast our net broadly, that would do something about the diet nutrition side of obesity, would address it in some way. 72 different policies. And we asked these 40 colleagues, because again, this is pretty standard in our trade, to rate each of them on a 1 to 7 Likert scale. You're familiar with those, I hope. 1 being it won't make any difference. 7 would make it meaningful. Sorry, this is the impact study. I'm getting it backwards. It would make a meaningful, it would have an impact. It would change people's consumption practices. We asked them to rate each. Most of our studies stopped there. What impact would this have? But we reached out separately and simultaneously to 40 folks in policy-making decision health areas. So actually former student of mine who is the lead health person at the Office of Management and Budget. So basically helps make White House policy on health. We asked people on the Ways and Means Committee, staffers. We asked people in the governor's office. 40 and 40 brilliant nutrition scientists, including folks here, who would rate the impact. And we took the same 72 policies and gave them to 40, parallel number, of policymakers. Asked them, is this feasible? Could this pass your legislature? Would the governor sign it? Asked them to rate them 1 to 7. Then we cross-tabbed. You guys know cross-tabs, very simple. So what we wound up with was a nice little 2x2 matrix. What we spent a lot of time on the public policy realm, unfortunately, is what would have an impact. We should pursue, and at this point in a talk like this, I say we should pursue these 8 things because we know it would make a difference. If none of them are feasible, what is the point of wasting our policy-making breath? What you need, and then what often happens in the policy realm, because I've worked there, and some of you have, I know as well, nod your head if this sounds familiar,
You pass what's feasible, whether or not it makes much impact, because you can get it through and nobody will notice or they'll reward you or whatever. We wanted to find that glorious cell where impact and feasibility meet. What policies do nutrition scientists say would have? The policymakers don't know if it has an impact. They blabber on whatever we tell them, or you hope, or what their staffers tell them. We want nutrition scientists to say it would have an impact and join that with things that we know are feasible, could actually pass. We spend way too much time in American public policy on those other three cells. High impact, we dream about, no feasibility. Or again, in the policy realm, high feasibility, but it wouldn't have much impact. And then sadly, we sometimes get hung up on things that have neither. I don't know why we do that, but we do. So we published this piece. It was enormously fun to do. We came up with this is the header, childhood obesity specifically, sorry, I should have said that. And we came up with 6 or 7 policies that would actually, we thought, make a difference. And we've been trying, those of us who do some lobbying or at least persuasion around this have been trying to promote those as opposed to all these others. This came out 5 or 6 years ago. We're replicating it now, meaning we're running it again just to see if things have changed. We want to do it for adults too, but point is, if this enormously complex, veto-enlivened, difficult to shift policy system of ours could possibly open a policy window long enough to make a difference, we got to know what matters, because we're only going to get 1 or 2 meaningful policies through. I wish we were France, which, for example, took an entire administrative area, significant portion of a prefecture in France, and basically said, right, I don't know how they said it, but oui, alors, 10 policies, we think they'll make a difference in obesity, we'll put them all in place now. It has been a rich trove for us researchers, but also it has made a meaningful difference. They cut things off TV, and they pulled the equivalent of 7-Elevens away from schools, and they put significant policies in place all at once. We'll never get there. So when the policy window opens, we need you guys to tell us what will be feasible. What will have an impact. We also need to know what might be feasible and take things in that top cell. So it's a sad story that's as far as we've been able to get. And I'll simply conclude by saying that there was a nanny piece to this talk, but I'll leave the nanny state part aside. But one hope of all this conversation, of talks like this one, of all this framing and battles and back and forth, is that we will begin to actually shift the nutrition and dietary culture of this country. We'll see meaningful shifts, and there's desperate attention to you millennials, or so-called Gen Yers. That's teenagers, 20-somethings, just turning 30, the Generation Y or millennials are, that your dietary habits have started to change. The piece today in the Wall Street Journal about the horrors at McDonald's because, particularly among millennials, consumption is down dramatically. McDonald's is both unhealthy and unhip. If these kinds of conversations can bring about some kind of meaningful national mood change or culture change in dietary nutrition practices, then perhaps all this policy conversation will have done some work. We shouldn't expect, though, and for the times you've had this thought, there ought to be a law, or we should just change, or it's very unlikely in our, again, labyrinthine, veto-rich policy system we're going to see any meaningful set of policies. So instead, you fight one by one, but hope along the way the conversation changes. Thanks for this wonderful opportunity to get together with you. I'm happy to take questions as long as these folks will allow it, and this was great. Thanks.
Before we open this wonderful talk to questions, on behalf of Rogan and myself, I would like to invite all of you to join Provost Kersh for a reception in the HNRCA. And now,
which will be filled with reformulated Oreos. So.
I was thinking while you were talking, I used to be a smoker. And all of a sudden there was a huge campaign that involved a lot of people, not just doctors,
right,
or industry as well, everything. And the number of smokers here is decreased drastically. So what stops you from trying to use that as a model to lower obesity in the U.S.? I mean, obviously you need private industry to help you out in this. Government can, there is the story about YouTube, the fact that they tried to do a lot of things to persuade young women to take folic acid, and they didn't. And then they add the folic acid to the flour, and all suddenly everything.
Right.
So what I'm saying is, why don't you use a model like this in that respect? Obviously, you can do it with, like in cigarettes, but
It's a terrific question. I will say that the first paper I wrote on obesity politics, which again was not a subject that political scientists were writing about until a handful of us sort of started, mostly writing about the agenda setting. The first piece I wrote was on the fascinating analogy of tobacco, sex, drugs, and alcohol, all areas that were once completely thought of as personal responsibility areas in this country. People used to drink a lot more rum than they drank water when water was unsafe and so on. All four of those areas, including yours, tobacco, became the subjects of elaborate regimes of U.S. government regulation. So if you believe, as the personal responsibility arguments always suggest, that our government would never touch something so private as the food we eat, think about the things we smoke, the drugs we take, the liquor we drink, and the sex we have. In all four of those areas, our government turned out to run roughshod over our precious Bill of Rights, personal freedoms. So I wrote an analogical piece, and what my co-author and I, Guy Brown, who got to see last night, lives in Boston, what we wrote about was we tried to extract some kind of blueprint for political action, for policy action. Was there things in common? These were across history. The bans on tobacco were quite recent, as you noted. Alcohol prohibitions back in the early part of the 20th century actually goes back long before that. The ban on family planning and reduction of abortion is from the Victorian era, the 1880s in the U.S. But we actually found these sort of steps to government action. Wrote a couple pieces about it. The place we got, and I anticipated this a bit in the earlier part of the talk, but is that you need interest group engagement involvement. When the anti-tobacco effort reached its hilt, if that's the right term, as we moved towards that enormous, government-driven settlement, there were 127 different anti-smoking advocacy groups organized together in a coalition called ASH. It was the anti-smoke, I remember what the H stands for, house, happiness, habituation. Anyway, 127 groups. I'll say again, for diet and nutrition related solutions, policy solutions to the obesity epidemic, there is one group active now. Now you may think, well, the American Heart Association. Find me their strong stances on diet and nutrition related to obesity. They back way off. American Diabetes Association, of course. I went to one of the ADA's wonderful national conferences. You guys go to these things. RDs are showing up everywhere at those, and not as many policy folks. That conference a few years ago was sponsored by Kraft, Hershey, and two other big food companies. These folks are not lobbying on those issues. So I don't know the answer. The model is there. I've written it out, and it's not that an academic paper moves anybody to do anything. But I do say to class after class and audience after audience, the barriers to entry to political advocacy in this country are very low. You can form an interest group on anything. And almost every other urgent issue, I'll just say once more, name one, and I'll tell you the 10, 15, 100, 200 groups that work on that. This one, there's one. And I'm baffled as to why. Great question.
I'm going to allow one last question by a student.
Something you guys want to know. I haven't bludgeoned you into silence, surely.
If not,
I saw a hand.
I guess that, sorry, with your New York City example, you highlighted the lack of context with the calories.
Yes.
They needed to know about the 2,000 calories. What does that say about all our federal funded nutrition education programs, that context has to be provided?
It's a wonderful question. And disturbing or discouraging in the extreme, right? I'll simply add, you've made the point rhetorically very powerfully. I will simply add that, I've spent the last 15 years working on this from various angles, including, I will say, an advocate. I began as a political scientist interested in how obesity got in the policy agenda. I knew nothing about, nor did I care much about obesity as such. And I've become deeply devoted to understanding the policy options that might result in better diet, nutrition, and reduction of obesity. So I'm in this space, right? The industry and its allies are a formidable lobbying force. I think one of the reasons we don't see the groups rise up is it's just a monolith it's hard to argue against, frankly, and you hope that changes. But they love nutrition education. They don't make the mistake tobacco did, back to this analogy, where tobacco stonewalled. So there's nothing wrong with our products. We don't know. Nicotine, what? Addiction? And they got caught. I'm doing this because they had, remember that 7 tobacco executives had their hands up before Congress and all lied and then, basically wound up either in the slammer or in big trouble. The food industry has been much more successful. Absolutely there's a problem. Exercise would be great. Sedentarism or whatever the term is. This is a real problem. And we need more nutrition education. They put the money in themselves. It doesn't work, at least in the ways we're trying to talk about. Kids, we think of yourself. We know what's better for us. And we transgress, there's that religious notion, all the time. We need something stronger than education. We need robust, I believe at least, we need robust, active policies that help people make better choices. Of course individual decisions will be involved, and we know we're not going to go the terrifying route of you'll see a picture of some of the nanny state opposition. And this is what you see about coming from the right and from the industry about the horribleness that is out there. But it has been a very successful portrayal of anyone who believes government should do something robust to solve this problem. It's a very successful message. What I want is this message. These used to be the nannies we liked and adored. So I'll leave it at that. Thanks. Hope to see you at the reception.